Hello everyone. This is Bshara Ghawi. I'm the Deputy Executive Director at Mentor Arabia. Allow me please to start by saying that this webinar is provided for international purposes only and does not constitute medical or treatment advice. The views presented here are those of the speakers and not necessarily those of ISSUP. Welcome again. We are very pleased to have Dr. Alexander Butchart and Dr. Wadia Maalouf with us today's webinar entitled Parenting Interventions in the Context of Prevention, New Guidelines and a Call for Action. Dr. Alexander is the Violence Prevention Unit Head in the Department for the Social Determinants of Health at the World Health Organization, WHO, in Geneva. His responsibilities include the development of policy for the prevention of interpersonal violence, preparation of guidelines for the prevention of specific types of interpersonal violence, and the coordination of research into various aspects of interpersonal violence and its prevention. A major focus is on preventing and responding to violence against children through development and implementation of the INSPIRE 7 Strategies for Ending Violence Against Children technical package. Dr. Wadia is the program manager of the prevention program globally within the prevention, treatment, and recovery section of UNODC from the headquarters in Vienna. Wadia addresses the culture of prevention globally by promoting the UNODC WHO International Standards on drug use prevention and related tools. He supported the development, dissemination, and evaluation of family and parenting interventions in several contexts, including in humanitarian ones. Dr. Wadia is also a contributor to the UNODC WHO International Standards on Drug Use Prevention, the INSPIRE initiative to end violence against children, the Helping Adolescents Thrive to prevent and promote mental health in adolescents, and many other interagency initiatives. This webinar will introduce the recently launched WHO guidelines on parenting interventions to prevent maltreatment and enhance parent-child relationships, and the related recommendations for relevant governmental and non-governmental personnel responsible for supporting, establishing, guiding, training, or availing such services, as well as developers, managers, or academicians implicated in evaluating such interventions. This webinar will also reflect on the ongoing work on further improving the culture of prevention through the UNODC WHO International Standards on Drug Use Prevention and the value of such new parenting recommendations in this context for prevention of drug use, violence, and other negative social and health consequences. It will also describe experiences in implementing such parenting interventions in different social contexts, including in humanitarian contexts as call for action to re-engage and support families as a core social institution, particularly at a time of post-COVID-19, where there is an imminent need to reignite global commitment to accelerate implementation of the Sustainable Development Goals between now and 2030. We will have a Q&A session at the end of the webinar, so please submit your questions in the question box. Dr. Alex, the floor is yours.
Thanks so much, Bechara. I will be sharing my screen, I hope. Can you see my presentation?
Yes, I can see it.
Very good. Okay, so thanks very much to ISSUP for inviting this presentation, and good day to everyone. It's great to see a good turnout. I'm really delighted to introduce the WHO guidelines on parenting interventions to prevent maltreatment and enhance parent-child relationships. Ready access to effective parenting interventions is essential. Harsh and violent parenting can result in many severe long-lasting consequences and substantial associated costs to the economy. These consequences include poor mental health, injuries, disability, and death, high-risk behaviors like unsafe sex and drug use, communicable and non-communicable diseases, maternal mental health problems, and intergenerational violence transmission, including intimate partner violence. And there's really now a great deal of evidence that interventions to prevent harsh and abusive parenting and enhance positive parent-child relationships are effective. They have great potential to reduce many high-priority public health and criminal justice challenges, and that's why the WHO guidelines have been developed. Wadi will provide some excellent examples of how this can be applied to various outcomes within the context of UNODC's work. The guidelines consist of the core document and a web annex. The core document sets out the methods and the recommendations. It also lists the government and non-government personnel and the scientific experts whose inputs were critical to ensuring adherence to the WHO guideline development process, reviewing the strength and quality of the evidence, and formulating the recommendations. In the web annex, the grade tables provide detailed information on the strength and quality of the evidence for each of the recommendations. The evidence to decision tables provide the detailed justifications underlying them. Central to the guidelines is the definition of what a parenting intervention is and an evidence-based listing of the essential components. As shown here, parenting interventions aim to improve parent-child interaction and the quality of parenting. They usually come with manuals providing step-by-step instructions to ensure that they're delivered with close fidelity to the source intervention as tested and shown to be effective. The interventions are highly structured and directed at parents and caregivers. The focus is on developing new skills and behaviors and not just on didactic instruction. And they emphasize the importance of parents learning and practicing new skills. Parenting interventions can be universal, selective, or indicated, and can be delivered from centers, through home visits and online, to groups and single families. Delivery staff can be professionals or paraprofessionals, and these interventions can be combined with others, such as household economic support. The essential components of effective parenting interventions include assisting parents to engage in non-violent discipline techniques, such as pointing out the natural consequences of risky behaviors, strengthening positive parenting techniques, such as setting clear rules and giving positive and direct commands to children, positive reinforcement, parental self-management skills, and improving relationships with children. As noted previously, critical to the effectiveness of these interventions is their emphasis on skill-building exercises and practice opportunities to help parents acquire and internalize the new skills. In reviewing the evidence for this guideline, 7 outcomes were prioritized, assessed across all the reviews, and graded for certainty. These determined the strength and direction of each recommendation and were child maltreatment, harsh and negative parenting, positive parenting skills and behaviors, child externalizing issues and behavioral problems, child internalizing problems, parental mental health, and parental stress. 4 non-prioritized outcomes were also assessed, and these were intimate partner violence, parental self-efficacy, positive parenting knowledge, attitudes and beliefs, and parental attitudes to corporal punishment. Although they didn't directly influence the recommendations, Assessment of these 4 outcomes provided important insights, and the findings on them are reviewed in the web annex and underlying review reports. The guidelines have 4 new recommendations and 1 recommendation adopted from WHO's 2020 guidelines on improving early childhood development. Recommendation 1 states that in low and middle income countries, evidence-based parenting interventions should be made readily accessible to all parents or caregivers of children aged 2 to 17 years in group-based or individualized formats delivered through a variety of stakeholders, including government organizations such as health, education, or social services, and non-governmental organizations. Recommendation 2 is similar, but global in scope and focused on children aged 2 to 10 years old, and interventions informed by social learning theory. Recommendation 3 is specific to parents of adolescents aged 10 to 17 years in low and middle income countries, and it highlights the importance of considering the specific needs of adolescents and the parents of adolescents. Recommendation 4 focuses on humanitarian settings within low and middle income countries, and it highlights the importance of adding elements that address the impact of humanitarian stressors on recipients' mental health. Recommendation 5 is the one borrowed from WHO's Early Childhood Development Guidelines. It's global in scope and is to ensure that all infants and children receive responsive care during the first 3 years of life, and that parents and other caregivers be supported to provide such care. For each recommendation, the following key content is provided: the justification, meta-analyzed effect sizes on the 7 prioritized outcomes I listed earlier, assessment against WHO's integrate implementation criteria, including health equity, equality and non-discrimination, and human rights and socio-cultural acceptability. There are also implementation considerations and research priorities. A concluding section of the core guideline provides an overview of the adaptation and implementation considerations shown here. We're currently developing a handbook that will elaborate this by providing detailed, evidence-based, and practice-informed information on how to set about selecting, adapting, testing, and scaling up parenting interventions. The full set of guideline materials, including the core document, the web annex, and the very extensive unpublished reports on the effectiveness reviews and the WHO integrate implementation criteria, are collected at the website shown here. So many thanks, and for more information, please do visit the guideline website. I will stop sharing now and look forward very much to hearing Wadi's presentation, which is really going to focus on how the kind of recommendations included in these guidelines are applied in real-world settings for pressing problems that we will all recognize as important priorities. Thank you.
Thank you very much, Alex. I'm trying to share my screen. Hopefully the screen is, you can see it. Actually, let me rephrase. I hope you see the right, correct screen, the one with the full projection.
We see it, but not the full projection.
Yes, the beginning. Yes.
This is the speaker's mode.
But it's I'll have to go to the first slide, unfortunately. 1 second. Can you see it now?
Still the speaker.
Maybe you should check the display setting. Yes.
Okay. Yep.
Yes, now it works. Perfect.
Thank you very much. I do apologize for the technical glitch, but that's one of the problems of having two parallel screens. So to follow up on Alex's presentation, first of all, to mention the fact that we have a very strong collaboration with WHO, given the health response for drugs. And, we have on more than one desk with WHO a relationship, both on the substance use and mental health, that really works with the population that's actually using drugs, but also from a prevention perspective, the population that is at risk and vulnerable to use drugs. This is where the partnership is on with the social determinants of health work. So on both fronts, I'd like to reflect how is our articulation of the health response to drugs as UNODC being put on the ground. So the first and essential element of the presentation is the fact that regardless who we are within the UN family, we're all working with the member states on supporting sustainable development goals on the road to 2030. Needless to say, in the field of substance use, an essential new element that has been emerging compared to the Millennium Development Goal is the fact that under the health portfolio of the Sustainable Development Goals, SDG 3, there is a specific target on strengthening prevention and treatment of substance use as part of the development of the country. And hopefully, this will be articulated more in the sense of the presentation, why it is linked to sustainable development. So we have two tools. I know I wanted to focus more on the prevention of substance use, but there's also the context, the aspect of preventing the health consequences of substance use, where the family can play a role. So I will allow myself to just juggle in between the two, both the UNODC WHO standards on drug use prevention and the one we have on treatment, just to reflect how much the family and where does the family and the parenting skills contribute to both spectrum of the response. The prevention standard, I won't have time to go into too much details in them, but the main essential component of the prevention standard is changing a culture of prevention among the population of policymakers that are availing services, making them reflect on the fact that substance use is the result of a vulnerability that exists at the individual level. Different people have different genetic makeup, the reactivity to stress, different cognitive abilities, different intellectual abilities, determining who they are as a person, even between siblings in the same family. But these people are also within a social context of social institutions surrounding them that influence them in a good or a bad way, depending on their skills. But also even these social institutions are within a larger construct that determines how the functionality of these social institutions, but also the larger context, carry an effect directly on the individual. So basically in that context, there's a science of what works and what does not work, and the prevention standard articulate that science. Drug use prevention is not only talking about drugs and raising awareness on drugs, and it's not a free choice, excluding all these vulnerability that, children especially, or early adolescents are asked just to say no to without any other further support. But most importantly, in the context that we are discussing now, is the fact that most of the interventions in prevention focus on intellectual, language, cognitive, emotional, and social competencies at every single age of development, meaning that the prevention work really has to focus on an element of supporting the milestones of development of the child from birth onward, moving forward. And it's not any prevention that is key, that can be, and the worst outcome is not an ineffective response, but any wrong prevention that's outside the scope of the science of prevention can lead to a iatrogenic effect, meaning that the intervention per se has caused more risk than the absence of that intervention. So in that context, we can see that we talk about a spectrum of so many different institutions that can prevent substance use in line with the standards that I just talked about. But because there's a developmental process now, you can start appreciating how much the family as a social institution carries an effect on that positive and healthy development if armed with the right knowledge and expertise. So supporting families in the substance use response is linked to so many political declarations now that I will not have the time to go into many details, but at least on the parliament that deals with drug response, the member states, the Commission on Narcotic Drugs, the number of resolutions, commitments that articulate the word prevention is on the rise, and that prevention standard supported that element moving forward. But also, it's not only saying prevention, but saying prevention that is in line with the science that is key. Most recently, not last year and not this year and the CND before, we had a resolution that is a landmark resolution on promoting comprehensive scientific evidence-based early prevention, meaning that starting prevention at the ages from 0 to 8 years of age, where it's a completely different context of what the policymakers are absorbing the field of prevention and what kind of prevention can be availed within that period is key. And we're keen on supporting that momentum moving forward. So this is the vulnerability matrix in a nutshell that describe the personal characteristic, the micro influences, the macro influences, and you can see the family influences in this context, how they interact with the personal characteristic. We talk about for lack of involvement, harsh, abusive, neglected parenting, negative moral modeling, stressful, chaotic environment, parental substance use in certain instances, and how these affect, interact with the personal characteristic. But also there's a larger context where these families are in that affect how these families function. You can appreciate a family that is in a conflict setting, in a context where there's a lot of violence, there's availability of drugs, there is accessibility to drugs. All of these, contexts influence how the family functions, but also carries an effect on the individual. But most importantly, while we're working on substance use, that vulnerability that we're talking about is not unique to substance use prevention, but is also linked to other negative social and health consequences. These same vulnerability can be linked to violence, can be linked to violence against children, can be linked to mental health, school delinquency, and beyond. And this is the area of where we have a lot of intersection with many sister agencies of the UN supporting more than the domain of preventing substance use. So Alex already alluded to the fact that what we're talking about parenting skills, because it's important when UNODC approaches it. We're not talking of parents being police officers monitoring whether or not the kids are using drugs, but really we're developing these skills within the family to have warmth, effective praise, listening, assertive discipline, helping parents to look after themselves, because these are key components to build a healthy relationship between a caregiver and their children to build more resilience in the child in different ages, of course, and the parenting skills need to be accompanying the age of development of the child. We know that the home is the single most profound influencing entity around the development of the children. The effects of parenting are long-lasting. They instill a social and emotional regulatory skills in the life of children and early adolescents to resist substance use, and they contribute to many risky behavior and the autonomy of the children and opportunity for overcoming this behavior in children. And wrong parenting styles can be related to negative influences or severely negative influences based on the characteristics of that parenting skill that we're talking about. From something as simple as inconsistent parenting skills up to harsh domestic violence, abuse, and neglect, and other parenting. All of these are linked to negative health outcomes. So skipping this is going to the perspective of parenting and family skills. We know from our outcomes, even within UNODC on drugs and crime-related issues, that good parenting skills and good family skills are linked to more than one social outcome, promoting one social outcome, from substance use, delinquency, pregnancy, school dropout, violence, depression and anxiety, and beyond. So it is in that context that we're promoting this culture, and I will do my best with the limited time that I have just to show you different ways where we're working with families in order to support that programmatic approach. So as a context, family, we're talking about meaningfully bonded people, whether or not they have a legal or a genetic bond, but a caregiver and their children. They could be biological siblings, but not necessarily at first level. So prevention-wise, if we go back to from promotion to prevention, the population that is not using drugs, but it had different degree of vulnerability. Some interventions are universal, meaning that they can reach everyone regardless of the level of risk. Some prevention is selective for subpopulations that are higher risk than the average population, and some indicated level of prevention, meaning that therefore the population that already showed a symptom of a problem where you need to intervene before it escalates to something more severe. So prevention-wise, you will see that description within the prevention standards in terms of color coding. The green are universal interventions, the yellow are selective interventions, and then the red are indicated level interventions. And you see that parenting skills is both universal and selective. And it's linked to so many different sort of outcomes beyond substance use, and they're important, but they focus on as developing these parenting skills require practice, and that's a component that is valuable that the parenting guidelines of WHO focused on. So some of the tools that we have, we start with the listen first. It's more of a brief campaign of promotion of positive relationship between caregivers and their children, brief messaging that targets different agents of prevention, but in the context of parents, the campaign is listen first as a jeu de mots, meaning that listen to your children and not just hear them, but also listen to science. And this is where we have lots of messaging for the parents, brief messaging in terms of what kind of parenting skills need to be put in place. I invite you to visit the Listen First page where you have the science documents in terms of what every single faculty of parenting is there and how to demonstrate it. And in that context, within COVID-19, we've added a specific element of caregiving during COVID-19 that is linked to this initiative. That's on the promotion side. But on the prevention side, this is where we start moving on a different set of tools. These are tools that are more interactive, where a facilitator is trained on a specific program and works with parents to address these parenting skills and work with the children as well in terms of family momentum, change of family skills. So we had a compilation of evidence-based family skills training programs that probably would need an update by now for sure. And we developed a guide in terms of how to implement family skills. But it is taken for a fact that many of these interventions are developed in high-income countries where the infrastructure might be different than the countries where we're working. Many of these materials are copyright protected and have royalties, and sometimes they require a high cost for their adaptation, given the nature of how they're going to be implemented as an infrastructure. Basically, the minimum thing when a DVD with a video material is produced, reproducing these video materials is costly in many places. So, but just to let you know that when we were introducing these evidence-based packages in different countries, the cultural acceptability and suitability was very high in all countries where we're implementing. And it is important that the first thing that they showcase in terms of change of momentum in the family is on several violence indicators, even though they were introduced from a drug prevention perspective. All of these articles that are popping out here are open source and can be downloaded online. But this is where we have compared in different countries the effect of these program on violence as portrayed by indicators from the youth themselves and the parents' rating of their children. A specific example where there has been a review of different parenting initiatives when we have been working in Panama, for example, in favelas around Panama City, where the Familias Fuertes program that we were introducing as a pilot there have changed really the context of how violence is being addressed at the community level, even though the angle we were working in is an angle of drug use prevention in line with the standards. But when it comes to scale up, open source materials are key. And this is where we were supporting open source material. One of the first program we have talked about was Family United. It's a universal based program that universal in the sense for any family, but it's designed for low income countries. It's designed low resource settings. It's open source, and we've been working in terms of introducing it in several countries. It's just its structure is available online without going into detail, but we have also developed studies to reflect how its level of effectiveness in several countries: Indonesia, Bangladesh, Uzbekistan, and currently we're working in Mauritius, and even we have a clinical trial in Italy. It's just to reflect that, you know, a family everywhere needs a package like this. It is essentially 4 sessions, and they focus on specific elements of proper caregiving. I will not go to the details of it, but we can talk about it in more details later on. Another set of family skills packages is a Strong Family as another example. And this is where another example of a package where now we're working on parenting under stress. Parenting is important, but parenting under stress requires a different set of tools. This is also a brief package that we've been implementing in different countries as well. In our perspective of changing the culture of prevention, and maybe as a lead pad for absorbing more parenting skills, because definitely parenting under stress requires more intensive work, but at least as a minimum set of skills, as a light touch 3-session program, this could provide the essential skills that parents need to have, caregivers, for them to care about themselves, understand their own mental health, read their stress in their children, and children helping also themselves relieve the burden on the parents, and as well as the burden on themselves. So it is evidence informed, and it's open sourced, and there is a logical framework of its implementation. The program has been piloted in several countries. We started in Afghanistan just because we had an opportunity of being there, and there's a high need to implement such a package. And the work that's been done reflected on a specific scale, like the strength and difficulty questionnaire, which is on the overall rating of how much challenges the parents they have with their children. Overall, as overall parents, you can appreciate that they have lots of challenges with their kids. In the orange, the spectrum of color reflect the spectrum of how much clinically significant are the problems that the parents have with their children. And on average, after even it was a brief, as I said, it's 3 sessions. Every week it's 1 hour or 2 hours, and within 5 hours it's overall a reflection between the facilitator and their parents, and the care facilitator and the parents and the children. You can see that the rating of the same child over time, by 6 weeks after the intervention, dropped to normal level of rating for the children, and within the subgroup that were at the higher level, bordering with the red zone, also that has improved. And by the way, it was also gender sensitive in the sense both boys and girls affected it positively. So we are also within that culture, you know, the culture of providing more evidence from low-income countries is also key in terms of transferability of this material. So while we started in Afghanistan, we work also on Serbian Afghan refugees that are in Serbian camps to see if, you know, with the context of transition, how much we can support such stress as opposed to being internally displaced within the country. And we also worked in Iran as a clinical trial demonstrating the effectiveness of this program between Iranian and Afghan families residing in Iran. And all of these are available to you. So just to reflect that these level of, you know, light parenting, when they're structured and based on science, can be effective in terms of supporting parents. And these are a few of the background to showcase the fact that, you know, they're implemented in basic background without the need of very structured material, but without the need of fancy infrastructure to implement them. They're available in many languages. So another element that I would like to highlight is the fact that, you know, while I'm talking about the Crime Commission, the Drug Commission, CND, we have another parliament of member states that meet on the crime response within UNODC, and more, these tools that we're talking about, the Crime Commission is understanding that they have a social element to prevent crime as well and violence. So basically, for example, Resolution 28.1 from the CCPCJ, the Crime Commission in 2019, articulated how, you know, Strong Family, a program developed under the prevention standard, is one of the programs that can be under the umbrella of strengthening the engagement of all members of society in crime prevention as well. So that's another role of the family can play in this regard. Very big geographical spread, of the work. And now I will jump immediately to a social context that we have more and more is evolving. It's the context of humanitarian settings, both war-based humanitarian context, as well as natural disasters, where caregiving there requires not only an imminent need, but also probably a different infrastructure of implementation. Families in many of these contexts is the only line of defense. And this is where we have developed a multi-level pyramid of tools, from basic leaflets to distribute to intensive parenting programs moving forward. So, for example, Manchester University was putting brief leaflets of what essential parenting things you have to account for and things to read with your kids in bread bags that were distributed in Syrian refugee camps in Turkey to a bakery that's distributing bread to, by the way, refugees and Turkish residents that were there. So many of these areas, both subpopulation would need these tools. That has escalated into many leaflets and booklets that we have distributed, including interagency leaflets that were distributed most recently, actually in the Syrian and Turkish earthquake situation, but also before that during the Ukrainian crisis that happened, to support parents that are on the move with basic information that they need to do in terms of how to care for your children in that context. But also we had a more detailed version, which are booklets of how to work within this subpopulation. These booklets go into a bit more detail of how to care in displacement or in crisis situation with these children. And we have also clinical trials, for example, in Palestine, where we have documented the effectiveness of these tools. They go on reading material of what might your child be experiences, how can you do to help your child, how to care for teenagers if you have them at home, providing warmth and support, fears, anxiety, night disturbances, and beyond. So strong family goes to another level now. The first two levels are self-read. They don't need a mediator. Strong families and other packages probably, but in our situation, this is a package for parenting under stress. We require a trained facilitator. If the context allows for that interactive modality, it's great. And now we have an e-learning platform also to reach facilitators in contexts where travel of international consultants is difficult. And then, of course, trauma. The Norwegian Children and War Foundation had a program called TRT, Teaching Recovery Technique, where Manchester University was working in terms of adding a parenting component to it, TRT Plus. And we had a clinical trial to demonstrate how, when you restore parenting after addressing the trauma in parents and their children, how much it will have an extra effect in terms of recovery of mental health of both caregivers and their children. And we had a 3-arm clinical trial in Syria for Syrian refugees in Lebanon. So basically, parenting from a prevention perspective is a common denominator to many strategies, such as the INSPIRE initiative to end violence against children, youth violence, adolescents, mental health, and also to an extent in preventing of child recruitment into extremist groups. I mean, of course, the strategies there require much larger implementation, but also you can appreciate the role of families in that context. Now, all of this was for the subpopulation that's not using drugs. What for the population that is using drugs? Of course, family and parenting skills can play an essential role in the arsenal of treatment responses as well, where the family can be implicated in the treatment of children and adolescents that are using drugs. And family therapy is one of these interventions that have been reflected several times in terms of in the literature in terms of being effective. Actually, family therapy is WHO recommended treatment for example, cannabis and stimulant use disorders. So family therapy can play a different role in terms of reduction in drug use, delinquent behavior, and other sort of indicated level of prevention or early treatment, if you would like. But it is in that context where low middle income countries as well needed tools that are designed for their purposes. And this is where TreatNet Family is another tool that has been put in forward by UNODC to support the larger arsenal of treatment responses for substance use disorders and how the family can be implicated in the substance response when adolescents that are facing either problem with the criminal justice system or are using substance use for their rehabilitation and recovery. Talks about family engagement, relationship reforming, family behavior change, and family restructuring. So I'm not going into the details of it, but just for you to appreciate, for them to allow some time for question and answer, that family also and parenting skills can play a role within that treatment response. Also, just to give you a bit of context of where these programs are implemented, the social structure where these programs are implemented requires some basic element like this of support beyond the regular healthcare and over and beyond the regular healthcare that's provided for treatment of substance use disorders. These are some of the early feasibility studies that were done on family skills. Also, there are other tools for children and actually guidelines during pregnancy that are also developed by WHO in terms of dealing with children exposure for substance use during pregnancy that are key and require in terms of especially during the pregnancy period and shortly after delivery, identification and management of substance use and substance use disorder where parenting skills are implicated. Over and beyond the treatment modality, we have an SOS initiative that is an initiative to address overdose, where family involvement is also key in reducing negative and health consequences. And to this effect, families can play a significant role in addressing potential overdose prevention in their children. So, of course, within the recovery and support of substance use disorders, family and social support is key, and we're promoting these intervention also in so many different countries, particularly this slide for TreatNet Family to reflect how many countries could benefit from this sort of initiative in terms of parenting. So it is in that context how the parenting guidelines, as discussed by WHO, are key features to really mobilize the mental state and the kind of thinking of policymakers and service providers to really capitalize on the importance and value of parenting and the family as a social institution for availing services. Family is key for us and is linked to many sustainable development goals. Good parenting skills that are introduced provide more than one SDG target, regardless of the target that is your point of entry. So I would just like to acknowledge all my colleagues from PTRS for this support. Of course, I acknowledge WHO and partnership on more than one level, the expert and consultants supporting us in the process, the interagency collaboration that we have with many agencies, but given especially that Alex is there, WHO is a key sister agency we're collaborating along with, and our donors and actually the recipient countries that are taking these programs in. The scan will take you directly to our website where many of these tools are there, and feel free to contact me if you need more information on this. I will leave the floor maybe for more question and answers, and over back to you, Bshara.
Thank you. Thank you, Dr. Wadia. Thank you, Dr. Alex, for the really insightful presentations. We had, in fact, lots of questions from the audience. I also would like to ask everyone to put their questions in the question box. Meanwhile, we have chosen few questions in order, because we have some time limitation, and some of the questions were already answered during your presentations. So feel free, either Dr. Wadia or Dr. Alex, to answer those questions depending on your expertise and on your knowledge in regarding the topics. So the first question, how could local organizations be equipped and with training and implementation support to expand parental skills training in local communities? Who would like to answer? Dr. Alex? Yes.
So that's a great question, and that underlies the reason why WHO is really committed to making available parenting interventions that are not at cost. There are many effective interventions that do cost a lot, and you have to subscribe to the intervention developer and pay a lot of money for the manuals and the training. But WHO and colleagues like UNODC, WHATIS materials, groups like Parenting for Lifelong Health, groups such as CDC, groups like the Global Initiative to Support Parents are all committed to free materials. Well, let me not say free. Materials where there is open access to the manuals. Because at the end of the day, you will still have to invest something in training. It's not just any old approach that works. The science is quite clear on what has to be done, by whom, and what kind of training is needed. So you do have to invest something in that, but we would like to make it possible for a very low bar in terms of the cost to be there. Wadi, comment from you?
I totally agree with you, Alex. I mean, there are more and more open source materials that are there, but building a skill, a parenting skill, requires training. And this is where there's a session component where the material are free, but an appropriate training to be a good vehicle of them, a good facilitator of this material is key. But in the context of a volatile situation where the training cannot be done, also there are brief parenting material on an emergency purposes that can be released, require no training, they are free of charge, they can be downloadable, and these could be also essential, providing an essential level of information until a more sort of interactive modality of really proper skill building can be put in place.
One brief addition. Increasingly, people are developing digital modes of delivering parenting support interventions, which of course will reduce the cost and massively increase the accessibility. In addition to pure digital, there are also hybrid modes being developed. So some parents may benefit from just the digital, and a smaller group might need digital plus in person. But the evidence is still quite far behind the evidence for the effectiveness of in-person interventions, but it's coming.
Thank you. So the next question, Family United has only 4 sessions and strong families. How do these sessions make long-term impact, especially that there are many social determinants of health that affect parenting skills?
Totally valid question, because these are the basic minimum skills that can be put in place. I mean, both Family United and Strong Families. Family United is, as I said, done universally. So any family can come in and take the minimum set of skills they can benefit from. Needless to say, there will be families with different level of needs that might be, faced. Strong Family is more, let's say, universal within a selective setting, meaning that, you go into communities where there's lots of stress, but you invite them. So basically, maybe the level of when you're inviting everyday family that are living in this context to come in, probably the probability of needing more than the actual content of the package is eminent, right? So these tools introduce a large chunk of the families to the basic need that they have to avoid escalating a problem to something else. But there are also an opportunity for the facilitators to have a first-hand approach to engage with families and have with him or her a list of other social services that are available at the community level to network and link additional services in that might go into further sort of needs of the family. So they could be also mechanisms of engaging with the families to direct them in the appropriate way for the appropriate resources to have and move forward. So they are not solving all the parenting skills, but the basic minimum skills that they have. But probably Alex would have more details on this.
Yes, I will leave the last 2 questions for Hala, and I will leave the floor to her also to end this session with those 2 last questions, because we are limited on time. Thank you, Dr. Wadia, and thank you, Dr. Alex, and looking forward to our next sessions.
Thank you, Bshara. So our next question is, many parents ask us for resources they can read themselves on their own. Is Listen First a resource we can share with them for prevention from risky behaviors with their children? And what other resources like books or trainings can we share with them, in your opinion, that they can do on their own?
Wadi, I'll just be very brief. You mentioned the parenting tip sheets that we began producing as an interagency collective during COVID, and then they have been generalized, as what he said, to the Ukraine situation, post-earthquake situation, Syria situation, flood situation. These are the most immediate and readily accessible in hundreds of not hundreds, probably around 100 languages. So that is your very, very most basic free resource. And typically there would be a set of 6 to 10 tip sheets covering things from discipline to parental stress, how to explain to a child in a positive disciplinary way what to do, etc., etc. Beyond that, some interventions include public service announcements which go out on the radio, etc., and therefore are utterly free for those who can listen to them. And as I mentioned, the efforts to kind of scale up digital would also be providing immediate resources, but still have a way to go. Wadi, you probably have a much better answer to this, given all those enormously good resources you've developed.
No, I totally agree with you, Alex. What you said is very accurate, but you know, the main context remains that whenever feasible, building a skill is much more efficiently built through interactive modalities. But of course, there are lots of parenting tips that are there. You know, from tips actually to, we have also, if you go to UNODC site, we have also booklets that go into more details than the tips. But this remains something that is, as you mentioned, self-learned. But if you really want to master the skill, you know, practice that Alex mentioned is not something also for the facilitator to practice, to be really kind of fluent with the material, but also the skill that the parent need to do as demonstrator facilitator can be improved and fine-tuned and to the age appropriateness of the child as well, better through an interactive session. But there are many tools that we have, and I'm sure on the WHO site there will be even more parenting tools that we have, because we focus more on the parenting elements that are linked to maybe violence and drug use per se. But there are, parents can play a role in child development beyond these two elements, of course. Yeah.
Thank you. Another question is how to develop insight into parents who believe that nothing is wrong with them at all, and the problem is only with their kids and the behavior of their kids, and the kids should be disciplined themselves, especially if the parents are uneducated, looking into the refugee maybe population that you have been working with, Dr. Malouf.
I'll let Wadi have a first go at that one.
Yes, I mean, anywhere we go, I mean, we alluded to two things, right? There are parenting skills and there are family skills where, you know, sometimes the parent and the children are also implicated. But needless to say, regardless of the point of entry, whether it's a parent or a family skills, it's the parent that needs to realize that the change have to happen in them so that the child happens in the child, right? So that's a key component of any initiative. How to draw the parents to come in requires a specific strategy, but once they're in, they appreciate the value of this change in parenting and things moving forward. The difference between parenting and family skills is when you have the children there, sometimes the child sees a change in the parenting behavior and they know the parents are, you know, part of an initiative, is like, and they feel like this change, their influence, implicating the child in the sessions where the family component are there further adds to the value sometimes of that change in terms of family momentum within the family. But of course, it comes as an extra investment in resources, because when you're working with the parents, it's different than working with the parents and children. But probably in the context of child maltreatment, WHO would have more, and you know, this is where the parent is the key issue.
I would just add very little. In the underlying review of the evidence, the integrate review in particular, we have a chapter on recruitment and retention, which deals precisely with this issue. And the limited amount of evidence about this does suggest that once someone, a caregiver or parent, gets engaged, initial reservations and resistance tend to fall away, in particular when this is done in a group context. But I would leave you to go and find that. The document is several hundred pages long, but the chapter is not. The chapter is about 2 pages long. And there's some really helpful summaries of what we know from the science about recruitment and retention.
Thank you. This was actually the second question, the next question, sorry, which is related to the challenges faced. The main challenge faced is the recruitment of parents, so and the retention of parents. So you were saying, Dr. Butcher, that there's a chapter in the WHO guidelines that actually supports program coordinators. Maybe you can explore a bit more, since there's interest in this topic as well.
Well, very briefly, I mean, the obvious barriers to parents and caregivers getting involved is time. Many of them have to work, often in very difficult circumstances, for very little money. So the other barrier is money. The other barrier is feeding themselves, their kids. The other barrier is having somebody to look after their kids when they go to the parenting program. So in oftentimes very deprived communities where these interventions have been shown to be highly effective, incentives are provided in the shape of meal coupons, transport to and from the group event, food coupons, etc. So, and then they provide daycare or care during the time that the parent is involved in doing the parenting support work. These are some of the means that have been used, and which of course do add to the costs of the intervention. But given the extreme circumstances that many of these high-risk families are living in, these are investments that are pretty much essential from any kind of moral, ethical, public health standpoint. Wadi?
I totally agree with you, Alex. And the only thing I can add is a question you alluded to, Hala, before, is stigma. Sometimes, you know, one of the obstacles parents feeling they don't want to be implicated in these programs because they feel like, you know, we are a problem family, and that's why we're part of it. Especially probably less so for WHO than us when we come in with the UN drugs and crime coming in. But when they appreciate, once they get to the first session of these, and they appreciate what kind of sessions they are, linked to the retention rate, the families that go in, almost 80 to 90% of them attend all the sessions coming in, because we have these, you know, these impediments that Alex mentioned in terms of availing food coupons and all of these things, grouping the family, because they're part of actually the parenting component is for parents to exchange with each other also knowledge of what to do, and they do this around the meal. So these elements are there, but the only element is stigma. And, you know, once the program is in place, families start inviting other families to move in. Retention, as long as the package is as minimum resources, most of the families that come into these sessions finish these sessions.
Wonderful. Thank you very much. Our time is up for today. Dr. Alex and Dr. Wadia, thank you for a very insightful webinar, and it gave us, I guess, a better understanding of the importance of parenting interventions for the prevention not only of substance use, but also for violence and other negative social and health-related consequences. Thank you very much for your time. For all our professionals in the drug use prevention field in Lebanon, please follow us on Twitter, LinkedIn, and Facebook to learn more about future activities. Thank you, and good afternoon or good morning or wherever you are in the world. A good one to you.
Thank you. Bye-bye.
Thank you very much. Bye-bye.